Hi.
My name is Benson, and I'm going to be sharing with you all about asthma and its effects on people in everyday activity and on exercise. First of all, I want to share with you guys what asthma is for those of you who don't know what it is. Asthma is a chronic lung disease in which the lungs overreact to various materials in the air and some respiratory infections, meaning allergies such as grass and things like smoke can bother people's lungs and airways, and that can have to do with having the condition of asthma. It's astounding to find that there are 30 million people worldwide who actually have asthma, so it's more common than most people would think. And that would be because some people don't really know what it is, or that they have it, or if they do have it, they don't know how to get the correct treatment for it. And that's what I want to share with those of you who may have it or may know others who have it, just what the symptoms are and how it can be treated and how it can help. Some of the symptoms include coughing, wheezing, which sounds kind of like a low whistle, shortness of breath, which many people have in running, and also chest pain. Those symptoms can also be from other types of diseases or problems that people may have. That is why you should first check with your primary care physician or try to get in to see an asthma specialist, because they can help diagnose whether or not you have asthma. One way they would do this is through identifying your symptoms. They may try asthma medications on you and see if those work, or they may try lung tests to see if it could be something else. And that's a great first step, is finding out if you have it or not. And then you want to proceed afterwards in getting the right treatment. And even if you're struggling to get people to help you or get the right information, you need to continue to push in order to get the treatment so that you can be active and do everyday things like going on a walk with your kids or going on a run and playing sports. One of the types of medications they have are anti-inflammatory medications, and the most common of these include inhaled corticosteroids and long-acting beta-agonists. One of these that is common is Pulmicort, and another is Ceravent, and these are both medications that I myself take, and they work together. There are other medications where you don't have to have the two, where it's actually combined into one, and these will help if you use them every day. They will help just to keep your breathing right and just help you to function every day. And you don't stop taking them based on if you feel better or not, because then your breathing and your symptoms will get worse. So you take them every day. But there are some people who just have exercise-induced asthma, and in that case you can just take a medication known as albuterol. There's many different forms of it, but one common one is ProAir HFA, which is one that I also take. And what you do is, before activities such as running or playing in a soccer game or basketball or volleyball, you take it about 15 minutes before, and you take 2 puffs, and your doctor will walk you through how to take these different kinds of medications, but they'll help you to be able to do everyday activities with everyone else. And if you follow through and you get the diagnosis and you get the correct treatment, it'll help you to be able to sleep better, help you so that you don't have to miss days at work or at school, and just so that you don't have any limits on your physical activity. Some people think that you could have such a severe case of asthma that it doesn't matter what you do, that you won't be able to participate actively. But that's not true, because there are many very well-known athletes that are able to succeed, and they have asthma. One of these athletes is Jackie Joyner Kersee, and she was an Olympic gold medalist in the long jump as well as the heptathlon. And she struggles with it, but she was able to succeed, as well as Emmitt Smith, who many men may know, was an NFL running back for the Dallas Cowboys and the Arizona Cardinals. Those are just two examples of people who are able to overcome asthma and get the correct treatment so they're able to stay physically active. And I would just encourage those of you out there to go out and get the correct treatment so that asthma does not hinder you from everyday activities. Thank you.